A presentation from Crisis to Care, where we're focusing in on VR de-escalation and housing insecure communities. And our main goal is to reduce crisis calls in the Dallas community through innovative de-escalation programs by creating a 12-month pilot program within the Stew Pot that will use VR to teach de-escalation skills to people experiencing homelessness as well as staff.
Within a month, almost 1,000 calls were made to the Dallas Police Department concerning people experiencing homelessness. These calls create the space for escalations to happen.
And we decided to look for literature analysis just to make sure we know what's being said and what needs to be done when you're doing this research.
De-escalation is a nonverbal and verbal techniques used to reduce tension once it has arisen. Based on research, de-escalation is a powerful tool that can significantly improve the safety and trust within a community.
This is our LEAPS model, which stands for Listen, Empathize, Ask Questions, Paraphrase, Summarize. And this is a model that we're using to put on stickers to place on ID cards so people have a quick reference of a good de-escalation tool.
We are looking to bring de-escalation into the community through virtual reality or VR, which is a 3D simulated environment. This has already been proven effective under the program between SMU and the DPD.
Meet the Stew Pot. The Stew Pot is an organization that we decided to focus on because it's in the center of South Dallas, which is an area that is predominantly a food desert. It was founded in 1975. It's also a nonprofit and helps with basic survival needs. And they have a great partnership with SMU, which we thought that could create close partnership and easier access and opportunities to help.
And here are some methods that we came up while we started to work on our project. Although we did conduct some interviews with Stewport and Mission Oak, but we decided to go forward with Stewport because they were much forthcoming and they were ready for our interviews. And here is a list of a couple of methods, the people that we interviewed, the staff at the Stewport Center, the individuals experiencing homelessness, and officers from the Dallas Police Department. We also observed virtual reality de-escalation training sessions live, and we were able to compound our findings with existing research as well. We also found some existing programs and models already in the US that successfully helped with homelessness. Some of it, again, like I said earlier, is the Dallas Police Department that does the VR de-escalation training. A big one is the Pathway to Housing. Currently, right now, is the first model in the US that has successfully helped with homelessness intervention. They provide housing without preconditions. Diversion program as well helps with communication, problem solving. They provide support as well, and they help to resolve crisis early before it starts.
And these are our findings based on our visits to the Stew Pot. They serve homeless individuals, veterans, and people from low income. They do training once a year, which we thought this would be a great opportunity for us to give them more training. Based on our interviews, they say that stress, mental health, and shared spaces are some of the situations that escalate. And then current strategies is just basic techniques that they teach the employees, and our tools would be bringing better things. Some of the challenges are boundaries and preparedness of volunteers. And some of the key insights, they're very open and receptive to the VR training. So they're ready whenever we are.
So here are our recommendations. We want to implement the VR-based de-escalation program at the Stew Pot because the Stew Pot serves individuals where we want to build a peer support model where they can learn the skills to de-escalate situations themselves. We're going to do this by using existing framework and infrastructure. So that would be the SMU Stew Pot partnership where the volunteers for the VR facilitators can come from SMU as well as the actors. This will include 2 separate sessions, one for neighbors and one for shelter staff, and these sessions will happen every 2 months. For the neighbor training, it was to promote peer-based de-escalation and communication, and we want to help them build practical skills that they can use in their day-to-day life to keep themselves and their peers safe. This will be 10 people a cohort to maximize interaction, and the incentives will include dart passes and takeaway meals. There will be 1 scenario, a session, which is the scene that they are going to practice in. Here's a couple examples of the neighbor scenarios. The first one is peer de-escalation, and the second scenario is a high emotion individual. Now, the neighbors training is meant to support the neighbor de-escalation, and we want to expand on their existing training, which only happens once a year. And when our conversation with Miss Northcutt Stated that she wanted to improve the consistency and confidence of staff in their responses to crisis situations. A couple of staff scenarios for their sessions would include one where an individual is infringing on their boundaries, and the second one is if an individual with a weapon is on the facility. Here's an example of our model session structure. It includes a welcome, briefing, and VR orientation with 2 VR turns and a feedback session in between. And we ended up with giving the takeaway gifts and the LEAP stickers.
Now, you might be asking yourself, how are we measuring this? So these are some of the things that we're using. Participation rates. So we want to see who attends these events. Completion rate, who actually finishes it. And then we're also going to have a pre and post knowledge of the LEAPS model. So that's what we'll be using. We want to see like confidence increasing in de-escalation skills. The VR performance using the LEAPS scenario, which is very important, and then participation feedback, which is very important. It's useful, respectful, and relevant.
Here is our estimated cost of the pilot program for 1 year with the help of the Dallas Police Department, which brings our total to about $1,436. And without the DPD support, we're looking about $2,936.
We also found alternative funding methods once the partnership between the StuPod and SMU and DPD ends. There is the Meadows Foundation, Communities Foundation of Texas, Substance Abuse and Mental Health Services Administration, and Human Health Services in Texas, all of which either funded homeless organizations or mental health initiatives.
So, in conclusion, we decided that our program is very effective, it's easy to implement, it's very cost effective, and it would provide a means for the community to de-escalate situations easily. Thank you very much for listening.